but it's something that's very important in terms of how we're paying for health care for a lot of people. Shah, thank you.
So I realize I'm in a very dangerous position of being between you and lunch, so I am going to be fast, but this is something very important that we need your help on. So I'm going to tell you what it is. I'm going to tell you why it's impacting you and what you can do about it. How many of you have heard of 340B before? How many of you have heard about 340B? Okay, excellent. So in your packets are 2 sheets about this issue. You can take it home. It's yours to keep. But let me talk to you about what this program is. Back in 1992, Congress created a program called 340B. The idea was very straightforward. Hospitals and clinics that serve low-income and underserved communities could buy prescription medication at a big discount. The rationale being that those savings could then be used for patients. So hospitals could use those savings towards things like lower drug costs, free or low-cost health screenings, transportation to appointments, extra services for people that were uninsured or couldn't afford care. That was the intent of the program. And for a very long time, it was a program that worked, and maybe you realized it or not, it could have benefited you, your family, your neighbors, and your community. Here's the problem. Since 1992 onwards, not every hospital or clinic has used the program the way it was intended. Instead of using that money from savings for the items that I just described, some hospitals bought real estate. They increased executive pay. They bought or signed expensive corporate contracts instead of helping patients like you. That's not right. It's harmful. And when people in this room are still struggling to afford medication for cancer, for heart disease, for diabetes, for other issues, we have to recognize what it is, which is just not right. So here in Missouri, there's actually something being done about it. This year, the legislature introduced a bill, passed a bill called House Bill 2011. And all it's doing is asking for transparency. In plain terms, it requires any hospital, any health system that is using this 340B program to show where the money that they've saved is going. Think of it this way. If you gave someone money to buy groceries for your family, you would want to see the receipt. What did they spend that money on? What did they get? That's what is being asked of the state right now. 11 other states have already passed this legislation. Missouri would be simply joining them. So right now, this bill is sitting on Governor Kehoe's desk. He has less than 30 days to sign it into law. And so here's what we need from you. The most powerful thing that you can do is share your story. If you have struggled to afford your medications, if your medical bills have piled up, if you've had to unfortunately choose between your prescriptions or your groceries or your other bills, lawmakers need to hear from you, because real stories from real people in this state, their constituents, is what is going to make these politicians act. And so what we're asking is, if you are open to sharing your experiences, there's 2 ways that you can do it. You can either write it, and Gabrielle and Rachel will be happy to collect it, or our colleague Steve, the gentleman with the camera running back and forth, getting his steps in, has set up a mini studio outside in the hallway. So if you want to be mic'd up and if you want to share your story on camera, Steve will do a fantastic job of capturing it. Your story will not be shared or published without your permission. Full stop. So if you are open and interested in sharing your story, we'll capture it and we'll make sure that you ultimately decide, are you okay with us sharing it, passing it on to legislators, giving it to the governor's office, and making sure that your voice is heard. So that is our ask for you today. Thank you for being here. The fact sheets in your folders are a great starting point. You can take that entire folder back home with you. We're going to be here for a bit more. There's lunch, and I think Dr. Tuckson will provide final comments. Thank you.
Julia, the navigator, brought some information that's back here on the back table. I encourage you to please stop off and pick some up. Also, please ask our speakers if you have a question, something you didn't want to ask out. Be sure and ask them about this. There are drinks on the table here, but there's lunch just out there in the hallway. Carla, make sure before LJ leaves with your radon detector, you get it from, he's right here. Don't let him get out the room now, you know. Brother a little sneaky, so make sure now we can get that done. Be sure to fill out the post survey that's in your packets. That's very important to us. That kind of gives us an idea if we're meeting your needs and hitting the targets that we want to hit. We really appreciate you who are here in person with us. And for those of you online, thank you for joining us. I want to remind you that we will be available for streaming. You can go on Facebook and over to the HEAL website, and you can see this and the previous session that we had here in St. Louis. I think it was back in November or December. So please give yourselves a hand for being out here, and thank you very much. Lunch is out there in the back. Drinks are right there. Information about Navigator services also right there. Thank you very much.